P3 and ACE are two innovative and new programs that perfectly illustrate the academic practice partnership that we have between the University of Maryland School of Nursing and University of Maryland Medical System. P3 stands for Practicum to Practice.
Our P3 students can, as a third semester student, apply for a job at UMS, be interviewed by that unit manager, offered a job, and begin work as a student nurse.
ACE, the Academy of Clinical Essentials, brings together 4 med-surg students and midway through the semester, 2 additional fundamental students with 1 clinical instructor who is actually a nurse at one of the University of Maryland Medical System hospitals. The student instructor cohort takes care of 4 patients that the instructor selects at the beginning of the shift, and the students have a really full, comprehensive, immersive experience.
So what we've done is addressed their nursing staff shortage and our need for increased clinical sites and instructors.
In the rural areas and in the underserved areas, 80% of the anesthesia providers are CRNAs. With UMMC being our sister hospital, we have looked into how can we bring more CRNAs into this employment. So we have ICU nurses who will apply to our program, and what we first do is, as faculty, we go through all the applications and we say, okay, we have 10 ICU nurses who are eligible to come into our program. We then give those names to UMMC and they interview those 10 and they decide how many they would like to pay tuition for, and those students come over. They do the program for 3 years full-time, cannot work, and then they go back as a CRNA to UMMC and they work there.
The collegial relationships between our nurses at our hospitals and the School of Nursing faculty have been remarkable. And I think that what we will ultimately see is that patient care as the bottom line will improve.